The nursing strike at Saint Vincent Hospital in Worcester, Massachusetts marked its 7th month on Friday as the negotiations between the union and hospital officials continued to deteriorate with no end in sight. More than 700 nurses walked off the job March 8, citing chronic staffing issues made worse by the pandemic. Despite months of negotiations, the workers, represented by the Massachusetts Nurses Association, said the hospital owned by Dallas-based Tenet Healthcare would not meet their demands. The nurses now hold the record for the longest nurses strike in the state history. The nurses maintained that the nurse-to-patient ratio had been at an unmanageable level, leading to a decrease in the quality of care they were able to provide. The staffing problem started before the pandemic, and union officials said they had been negotiating with the hospital for more than 18 months before voting to strike. Worker Riteko said once the pandemic hit, care inside that building became exponentially more difficult to provide. They are not concerned about the workers or the people we care for. They are worried about their profit margins. The Massachusetts Nurses Association said nurses were overworked, did not receive proper personal protective equipment, and were sidelined in the name of profit margins before and during the pandemic. Riteko described situations where nurses had so much to do in a single shift. They were unable to bath, turn, wash or walk patients. She said she knows one nurse found herself in a situation where she had to choose between protecting a patient who was going to fall out of a bed or respond to a call from a patient with chest pain with no backup in sight. She added, being understaffed shift after shift, day after day, leads to errors. It's now patients develop bad sores and urinary tract infections. Nobody is there to feed them or even to hold their hand. In August, it looked like the strike would end when the two parties agreed to contract, but things fell apart over the return to work policy. Saint Vincent has hired some permanent nurses to replace the workers on the picket line and said it could not accommodate the nurses' request to return their exact pre-strike positions. What Tenet is trying to do is to send a strong message that other nurses should not get the idea to do the same thing. It is not on us how important it is for us to hold our ground, she said. This will be a bellwether. We are not going to back down.